Okay, welcome everybody. You're hearing from the EIF office, and I have a panel of people here ready to talk to you about the Engaging Disadvantaged and Vulnerable Families Literature Review. This webinar is particularly to look at how that literature review can be applied as part of DWP's Reducing Parental Conflict programme, as you know. We're expecting people to be joining us from local areas and from the providers that will be delivering those programs locally, and from DWP as well. I'm just going to take a moment to introduce the panel. So from the left-hand side, Jenny, would you like to introduce yourself?
Yes, I'm Jenny Ballantyne, Policy Lead for the Reducing Parental Conflict programme at DWP.
Patrick?
Hi, I'm Patrick Myers. I'm an Assistant Director in Children's Services in Dorset, currently seconded into the Department for Work and Pensions, working on the programme.
And Inês?
Hi, I'm Inês Pote. I'm a Senior Research Officer at the Early Intervention Foundation.
And my name is Ben Lewing. I'm an Assistant Director at EIF, and I'm responsible for EIF's work on reducing parental conflict. So welcome, everybody. Just a couple of quick words before we kick off about what we're going to cover over the next hour. We're going to start with an introduction to the literature review, which Inês is going to take us through. So we're going to look at the key findings, conclusions, and recommendations. Then Jenny and Patrick are going to share their reflections on the literature review report and connect it to the wider DWP programme. And then the panel will consider some key issues coming from the literature review and look at questions that either you will share with us or that we have already received. And that's just a reminder to you, if you do have a question as we move through today's webinar, please do let us know. Once we reach that point in the webinar, I will look at what the questions are, and then the panel will respond to those. So please get your questions in. Okay, so I'm going to pass over to Inês now.
Thank you, Ben. So I'm going to introduce the report briefly, which most of you will have received a couple weeks ago. So just in terms of the rationale of the review, so back in 2018, to inform delivery of the Reducing Parental Conflict programme, EIF was commissioned by DWP to undertake a review of the literature on engaging disadvantaged and vulnerable parents in parenting and parental conflict programmes and services. The objectives of the review were twofold. So the first was to summarise the evidence on how to engage disadvantaged and vulnerable parents in parenting and parental conflict programmes and services to inform policy and practice. And we were particularly interested in the literature on how to encourage parents to take up and fully participate as well as complete the programme. The second objective was to provide practical recommendations on how to effectively engage and retain families in DWP's Reducing Parental Conflict programme, although the wider recommendations are also applicable to other individuals working in wider family services. We first explored some of the barriers to participant engagement and quickly learned that for some parents, engaging with parenting or parental conflict interventions can be a daunting experience with logistical and emotional barriers. So some of these barriers include awareness barriers, such as the lack of knowledge on the availability of support services or a lack of recognition of the need to access support or assess support. The second is an accessibility barrier. So these are things like time and cost, as well as location of interventions, which may make it harder for some parents to access the programs. And also acceptability barriers, which include feelings of personal failure associated with seeking help. We also identified some specific barriers for accessing relationship support in particular, and some of these are barriers such as the perception that interventions can be unsuitable or detrimental to people's needs by, for example, bringing up issues that have been buried in the past, the notion that relationships are private and should only be managed by the couple, a reluctance by some parents to access support before a crisis point is reached, and the fact that acrimony and power imbalances within relationships can hinder some parents from accessing and engaging in support. As part of the review, we also identified some groups, some disadvantaged and vulnerable groups that can be less likely to engage in support. And these include, for example, low-income families, ethnic minorities, men, including fathers, families from younger LGBTQ, which include younger LGBTQ parents, and individuals with mental health problems. We found evidence to suggest that some of these groups find interventions are not tailored to their needs, and so they feel unwelcome and that the interventions are underserved. We also found that there are specific groups that are less likely to engage in relationship support in particular. So the groups that I just mentioned are groups that are more reluctant to engage in parenting interventions, whereas the ones that follow are groups that are less likely to engage in relationship support in particular. So, for example, couples that are considered to be at higher risk for relationship distress due to their age or income or education, as well as those that have wider stressors such as financial hardship and psychological distress. And also couples who are unequal in terms of resources, information, power, education, and religious views. Following on from this, in the review, we highlight a couple of recruitment strategies that might be helpful. So multiple communication channels, well-integrated services, and a personal offer targeted at disadvantaged and vulnerable groups are all seen as good recruitment methods. So this involves, for example, widespread and creative and informative advertisement that is targeted at specific individuals to raise awareness of the support available, but also to explain how the support might benefit the parents. Ensuring that there's face-to-face contact with parents before the first session can be quite helpful to ensure that the right people are recruited in the program and feel comfortable, heard, reassured, and are, for example, already familiar with the practitioners before they initiate the first session. Motivational interviewing for engaging families who may hold negative expectations of services was also something we identified, as was, for example, establishing meaningful and collaborative partnerships with agencies that already work with the target family. So, for example, collaborating with agencies that work with disadvantaged and vulnerable families, such as housing or employment services, or also making use of professionals and services with whom a couple already has contacts. So, for example, health visitors or antenatal services. And then finally, offering universal and preventative interventions or embedding relationship support within these universal services, such as schools, for example, can help to improve access before crisis points are reached. Moving on to retention strategies. Obviously, it's one thing recruiting parents, but another is making sure that they keep on coming back to the program and are retained and complete the program to its entirety. So we found evidence to suggest that interventions are most likely to be successful when they address retention barriers, which is probably quite obvious. So designing intervention delivery around the needs of the target population by prioritizing the barriers that population most frequently encounter is incredibly important. So this can be as simple as, for example, delivering interventions at suitable times and convenient locations. It's also important, we found, to create a safe and informal space for program delivery, so that this can lead to honest dialogue between program participants, and experiences between the different participants can be shared. This was found to create a feeling of social support, which will help the participants keep coming back. Tailoring intervention content is also particularly important, so understanding your population and tailoring the intervention content and delivery to them is particularly important. We found that to be important with fathers, but also, for example, for engaging ethnic minorities, making sure that the examples that are used are applicable to them and make sense to them. There's also a strong empirical evidence that developing a good therapeutic alliance, so a good working relationship between practitioner and parent is incredibly important and effective for engagement. And for this to occur, obviously, it's important for practitioners to be competent, well supported and supervised, but where there was also some qualitative work showing that participants value practitioners who are respectful, compassionate, non-judgmental, empathetic, patient, and honest. And along with this relationship, it's important to maintain frequent contact with participants in between sessions, but also when sessions are missed, to sort of check in with them and try and address the reasons for why that session was missed, for example, uncover material that had been missed. And also, another thing that can be quite important for a good therapeutic alliance is recruiting competent practitioners who resemble the parents. So they can resemble them both in terms of the background that they come from, the language they speak, the gender, the experiences, etc. That can help to create a good working relationship between participant and practitioner. Moving on to conclusions and recommendations of this report. So as I've said, initially, one of the objectives of the report was to recommend to DWP ways of improving engagement in the Reducing Parental Conflict program, but the conclusions and recommendations of the report are applicable for a wider audience. So the first recommendation is around having programs and services that have been co-produced with a target audience. So this is all about understanding the target population and developing and working closely with the target audience in order to develop and design interventions that address the needs of the populations that you're seeking to reach. The second recommendation is around monitoring data about attendance in particular. So the success of an intervention is dependent on the extent to which participants attend on a regular basis. And there are always going to be some issues with participant recruitment and retention. So it's important to aim for high retention rates by, for example, oversubscribing interventions, but it's also important to, throughout intervention delivery, monitor attendance rates so that you have a sense of how many people are being recruited, how many people are coming to the program, who those people are, and if there's a failure to recruit and retain the number of people you expected, sort of addressing your strategy to try and ensure higher attendance rates and to ensure that people you want are coming to your program. The third recommendation is around the fact that engagement requires a multifaceted response. So we didn't find evidence to suggest that there's, by addressing one barrier, you sort of deal with all the issues. It's very important to sort of cast a wide net and have many different recruitment and retention strategies that address, in particular, the main barriers encountered by the target population, prioritizing those barriers that are most frequently encountered, and also making a real effort to recruit the families who are known to be less likely to access support. So the low-income families, ethnic minorities, fathers, etc. The fourth recommendation is around the workforce skills and capacity. So as I've mentioned before, a good strategy for retention is the working relationship between the practitioner and participant. So a lot of effort should be put into ensuring that that relationship is strong, as there's evidence to suggest that is conducive to sustained engagement. So that is not only recruiting staff with the necessary skills to create that relationship, but also giving staff enough time to engage families, because it does take time to sort of check in on families after sessions and between sessions and deal with them sort of on a more one-to-one basis. That is really important for engaging disadvantaged and vulnerable families. As I said, also one way of building a strong relationship is to recruit practitioners that closely resemble the target population. Our fifth recommendation is around evaluation and growing the UK evidence base. So what we found was that while many of the recruitment and retention strategies that I've quickly gone through are kind of logical and already known to many of you, there is a lack of data that actually shows that these are effective. And so in every instance that a program is delivered and that new recruitment and retention strategies are trialed, it's really important to evaluate whether that strategy is actually making a difference in retaining your participants. By doing that with all the different programs, including the Reducing Parental Conflict program, we will be able to have more data to understand what actually works so that we can implement that in future with certainty. The final two recommendations are much broader recommendations, but we find them quite critical for engaging parents. So one is around a functioning local intervention system that's necessary for engaging families. So the fact that we require a coordinated approach across all agencies which work with families to engage parents. So local leaders have a vital role in ensuring that the services are communicating, planning and working together effectively to screen, identify and refer families. So that, for example, could be equipping practitioners that work in mainstream services such as schools, hospitals, to be aware of what signs to spot for relationship problems, for example, and identify those families and then refer them to the appropriate services. And then the final recommendation is addressing the issue of stigma. So around relationship problems in particular, there is stigma associated with accessing relationship support, which is why some parents and some families do not access support. And so there's a real need for programs and services to basically address this and to try and remove the stigma that is associated with seeking support, so that we destigmatize relationship difficulties, so that participation interventions becomes more of a socially normative experience.
Okay, thank you, Inês. Very helpful. Some really important messages there about both relationship and coherence. Jenny, could I pass over to you just for your reflections, please?
Yes, certainly. Yes, we thought we'd bridge Inês's start to the meeting with our own from DWP. I'm just starting with this slide, which feels to us to frame things really constructively. So we talk about families with difficulties rather than difficult families. So, next slide. Right, I'll just say a few words about the beginnings, the origin of this piece of work. We in DWP commissioned the work, as Ben has said, in the Family Policy Division, and in connection, of course, with our mission to reduce parental conflict. But it does also apply, of course, to parenting interventions, so there will be a wider audience out there for it. I feel that this is a report that we're going to have by our side now and for many years to come, because it really pulls together, I think for the first time in one place, the learning in how to engage disadvantaged and vulnerable families in this area. Some of you will recognise a fair amount of the contents, but we've got it all in one place, and we know that it's backed by evidence. And I think also we need to remember that although many of you will be highly experienced practitioners, there are always new ways of practitioners joining the workforce, and for them to have this learning in one place, I think should be very helpful. But I think we need to have it at our side to sort of proof how we're doing throughout the RPC programme. So just a few words about the beginnings. You'll know, of course, of the local family offer. Indeed, a number of you may well have been a part of that. And that was the exercise to start exploring how to improve relationships, and then most importantly how to pinpoint reducing parental conflict in local areas. So test and learn, and that characterises this programme really from its earliest days, and certainly going forward, because it's new and none of us underestimate the task involved. This is a sensitive area, and we are dealing with families, disadvantaged families, so we have to think very hard and be very careful about how we pull this off, and I think learning all the time. You'll know that we decided to target workless families in the first instance in terms of the face-to-face support that we're making available. We do, of course, look to local authorities to engage 20% of the take-up with other families with disadvantages other than being workless, but essentially workless. And of course, the statistics we found from Understanding Society showed us that children living in workless families are 3 times as likely to be experiencing parental conflict as those with both parents working. So that's our target. And of course, we learned a lot from the LFO areas, and we'll continue to do so. We want to keep a very sort of 360 degrees approach to this, looking and learning much of the time. So we always knew that routes to engaging parents in the face-to-face interventions, but also in more sort of immediate support that practitioners might be able to give, would be difficult. So in terms of our face-to-face interventions, we felt that the best way is to create referral gateways run by 4 of our LFO colleagues. And we realised that we needed their expertise and their active engagement to engage a good range of practitioners who we want to refer parents. So that's what we did. We've also, as you'll know, have challenged our providers in the invitation to tender on how they will go about that. And we will be just looking and learning the whole time. So I really can't emphasise enough that we will keep the programme under active review. Our programme board will want to know exactly what's being learned, what do we need to change, and so on. So the success of the face-to-face interventions in terms of engaging and retaining parents will be largely down to observing the lessons from this report. So we regard it, as I've said, this is evidence that can form the work of those who are in the audience today, but potentially a much wider audience as well. So we'll do a lot with the EIF to ensure it's disseminated broadly and just in the right places. So I'll just flag here and maybe a little bit later say a few more words about it, but the digital dimension to supporting families to reduce parental conflict. We have conducted some user research in the department, and we have learned some helpful lessons which complement this learning on face-to-face interaction, and that also will be circulating, but maybe an opportunity to say more on that later. But I really should say from DWP too that how much we appreciate everyone who's here today and those beyond who are involved, because it's going to take everyone working together to help us pull this off and get some national momentum. So I'll turn to Patrick.
Hi, everybody. I found this report incredibly useful for a variety of reasons, and Inês has very eloquently laid out the conclusions and the recommendations. And what's useful in the report is the recommendations are separated in such a way that practitioners, local leaders, and national organisations have some point of reference for their action, in order that we get better at engaging with more disadvantaged families. And those of us who work in local authorities know the challenges that has. But actually the document does lay out some approaches that we can do to actually improve our recruitment and retention. I think crucially, the point that's been made is that you need to plan a little bit about this and not just hope. So there's planning, and the other point that came across from the report was the issue around workforce. So somebody who will know of my ambition to develop a curious workforce that's questioning all the time about why things are such as they are, in particular families. The other point in the document was equally that engaging with vulnerable families can take time. And the message in the report is that local authorities and their partners need to recognise this in the context of actually operating in the real world, of actually building a level of trust with families that they can feel that the practitioner is their professional friend and able to help them in their journey, either through parenting programmes or programmes which deal with parental conflict, and much wider indeed. I mean, the messages from this report can be taken into a whole range of areas for consideration about how we do work more positively with those families who benefit most from the services that we provide. There are some practical issues about timing. I mean, the example about poor engagement of fathers may well be that we put things on in the day quite a lot. Perhaps we should be thinking about twilight and evening sessions, and I know some of you already do that, but actually thinking very carefully about how we might make it easier for fathers to engage in these programmes. The location, and that's about making sure that the location is not stigmatizing, if that's the right word, but actually thinking about locations where universal services generally operate out of. There is a cost to parents engaging in these programmes. One of them might be childcare. So it's about minimising how those costs accrue to a family so that access is made really, really easy. There is something around actually going back to the point we mentioned with regard to the way in which we conceptualise families, and actually realising that most families have a degree of self-efficacy, and that we need to adopt in our language with them a growth mindset rather than thinking that we necessarily confine the description of them to a deficit model. And I think that's really important. And it comes through in this report that the quality of the relationship, and we know this from restorative practice and other areas of work, is vitally important to actually making sure we engage with families in ways in which they can recognise and are willing to participate. Okay, RPC. We here, there is some stuff in there that we need to recognise, and I'm glad the providers are on the call this afternoon, because some of these families are not known to services, and we actually have to find a way of engaging with them. The estimated 1.2 million children affected by interparental conflict will not all be known to a targeted service, and they will be experiencing their contact with public services through universal means. We're testing new interventions. We know that parenting programs alone, where we don't deal with the parental conflict, won't succeed. If conflict's involved in the relationship, that has to be addressed as well as the parental relationship. And understanding recruitment and attrition routes through evaluation, I think, is very important. And the report gives us some guidance about how that might happen. Inês has already said about beyond the usual, you know, a functioning early intervention system is a real desire to make this happen. And we do know the pressures that local authorities are under to maintain their commitment to early intervention. We need to expand the routes of referral. So beyond, as I've said, the usual suspects, we need to be thinking about how we can encourage schools, GPs, voluntary and community sectors to think about how they can identify and, where appropriate, refer on to services that would help them, particularly in the contract package areas. And there's a very strong drive. If we're going to make this work, it needs to work across a partnership. This cannot rest with a local authority, but it rests with everybody who's operating with children and families across the local authority footprint. Okay. And the important part of this is it's about improving lives now. I won't go through all of that now, but it's helping couples to understand the impact of conflict on their children's experience. And for separated families, developing the motivation to strengthen co-parenting. That's a very important part of the programme, and we shouldn't minimise the potential impact that could have across family life. Okay, and conflict management, the key transition points, we know that, and we just need to be cognizant of the fact that at those points of transition, we need that curious workforce to just ask the question, how are things at home? Okay, won't go. Okay, that's it. And this is the interest. Some of you who are on the call, I know, will have been at a round table where we explored the route to reducing parental conflict, and that's our Minister, Justin Tomlinson, who opened the round table. Very impressed with the interactions he had with those who attended, but more importantly, demonstrated the commitment to reducing parental conflict from the centre of government. I'll leave it at that. Just one more slide. I'm not going to read that out. It just is about, I love the one in there. We empathise when someone is flipping their lid. And I think that just speaks the language that parents and children would understand, rather than necessarily framing it in reducing parental conflict.
Okay, thank you, Patrick. Thank you, Jenny. So, so you've had some thoughts from us about the report. What we're going to do now is just respond to some of the issues or questions that have come through to us. Just a reminder, please do send in further questions as we've been talking, and we will come to those in a moment. The first question for discussion for the panel is, how do we engage universal services in making sure they participate in the programme and act as effective recruiters into the face-to-face programmes, bearing in mind the current workload issues faced by many practitioners? So, universal services acting as effective recruiters. Jenny, Patrick, do you want to respond to this one?
Indeed. I'll kick off. I go back to the point that I've originally made in the presentation there, is that some families will not be known to targeted services. They will only be known to universal services, primarily schools I've got in mind. And in Dorset, we work very heavily with schools in order to deliver our local family offer, and learnt a lot, I think, about that level of engagement. I mean, the practitioner training is a key part of the programme that builds a bit of capacity and confidence in a wide workforce in delivering this programme. But what we're trying to do is not make it onerous, and actually the training is provided in such a way that it can be delivered at twilight sessions, and just the same way I was talking about parenting programs, to make it easily accessible to staff. And it's also about describing the benefits, I think, for the services. So in terms of schools, there is a saying, and people would have heard me say it before, home is where the hurt is, but school is where it played out. So in Gordon Harold's work around conduct disorder, we can begin to think about some of those behaviours in schools being triggered by things that are going on at home, and there's a benefit for the schools of actually being able to identify and remedy some of those issues that the family faces. The evidence base is strong. It makes a good case, and it makes a very strong case for some moral purpose in this sphere around making children's lives better now. So the actions that are being taken now have some long-term impacts, but they also have some impact on the experiences of children now. I don't know whether, Jenny, you want to add to that?
Just underline what Patrick's saying about the practitioner training available by DWP. We are absolutely delighted that now, I think it's almost 97% of local authorities have submitted applications for funding for the practitioner training and also the strategic leadership support. And both of them absolutely recognise that we want to catch parents who come through universal services as well as targeted ones. So that the model is very much that we expect local authorities to send a whole range of professionals, practitioners on these courses. And of course, the strategic leadership support that is very much has the intention of getting local authorities talking with their local partners. So again, recognising that there will be many hands through which the parents who we want to help will pass. So I strongly encourage that you knowledge pool open for business if you signed the contract. So encourage you to take that up to help make this happen.
I think the last point I'd make is the power of storytelling with regard to conveying the benefits, if you like, and the more we can make that real world and real life and lived experience, I think the more powerful the messages become about the reasons why universal services should participate. Yeah, I've had some feedback that from a group of GPs that thought this would increase their workload. I very challengingly said, I think it would decrease your workload because the issue will be resolved and you won't just be seeing the symptoms of it.
Okay, very useful. Essentially, if I've understood what you're saying right, this is about hearts and minds. It's about showing people how this is already their day job rather than an extra layer. And there is some support, particularly through the practitioner training and strategic leadership support there already. But it's for each local area to find a solution, to find a way of connecting this agenda to what universal services are doing already. Inês, I don't know whether there's anything you want to add to that? Okay, we'll move on to the second question for discussion there then, which is a key barrier to engagement is the parent's experience of the learning environment, including the programme content and literacy skills required. How can we address this barrier in order to engage all families? Inês, would you pick this one up?
Yes, so this links back to a theme that was recurrent within the report, which is around ensuring that the intervention content and intervention delivery is appropriately tailored to the target audience. So in the case of, for example, parents with low literacy skills, for example, it's important for program developers and facilitators to ensure that the content that's being delivered is not kind of reading and writing heavy and involves other tools, so audiovisual tools, more one-to-one contact, role play, discussions. So basically delivering the same content, but in a way that is applicable to the audiences that you're addressing. Also important, and something which we found while conducting the report is that different individuals learn in different ways, obviously, and most individuals will benefit from the same information being delivered in multiple routes. So just keeping that in mind as well.
Okay. Patrick, Jenny, I don't know whether you want to comment?
I endorse exactly what Inês said, and it is about actually the design of the programmes with a view to making sure that they do respond to a wide variety of audiences. And I've experienced, again, where that's been played out where much earlier in my career, where some parenting programs took place in a group of parents, or one parent's home, where there was a group of them, and actually that enabled them to have a different level of conversation because they all knew each other, and it was operated in a really informal environment, which was one person's home, and that worked particularly well, and removes that sort of feeling that there might be other people who are better than me because they were a common set of parents.
Mm-hmm. So I guess what's interesting here is that sometimes when people are thinking about evidence-based programs, they talk about dosage, this idea that you need to get sufficient dose of a specific intervention to show an improvement. Actually, we're saying something different here. We're saying that you need to understand the components of an approach and how important they are, but you need to get the relationships and the trust right. Otherwise, using this language, the patient isn't going to take the medicine. So it's not about the magic of this dose. It's actually about trust and relationships.
And Ben, I think the external evaluation, which we've commissioned, will help throw up some of this additional learning, because the qualitative interviews will be with providers, participants, local authorities, yourselves, basically. And I think there will be a lot to learn. Where we're perhaps not succeeding so well, why is that? And we will just need to put our heads together and work out how we can do better.
Okay, let's move on then to the next set of questions. Lives are busy and it's not uncommon for programme participants to miss sessions. How should missed sessions be addressed in order to ensure maximal retention rates? Inês, I think this is another one for you.
Yeah, I mean, this is also something that I kind of already covered while going through the report findings, but it also links back to something that Patrick's been saying throughout, which is ensuring as far as possible that the interventions are delivered at times and locations that participants can attend. So, for example, for engaging fathers, it might be having to run the sessions in the evenings and the weekends when fathers can attend, or even just asking the participants when would be best for them and accommodating for that. And then in terms of, so that's kind of the first part. And then in terms of missed sessions and how those should be addressed, well, because there should already be a good relationship between the practitioner and participant. Frequent contact, as I've already mentioned, should be continual throughout the intervention delivery. So not only picking up the phone and ringing participants to check in that the session was well, that they understood everything that was covered, but also in cases where participants can't make a session, ringing them up, asking them, find that you can make it, kind of not dwelling too much on the missed session, but sort of understanding why the session was missed and whether there's something that the facilitator can do to ensure that that doesn't happen again. It could be that, anyways, just trying to address the issues with the participant, and also covering the session briefly so that the participant understands what has been missed, and hopefully will feel that they can jump into the next session, essentially. So just that, maintaining that relationship with the participant.
Yeah, and I guess it links into the point, Patrick, that you were making about self-efficacy as well. That this isn't about creating a parent-child relationship, holding people to account for missing something. It's actually investing in their control of their own lives and supporting them to engage in this process. I don't know whether there's anything to add.
There are a variety of reasons why people would miss a programme, and going back to what we were talking about, that the restorative approach, we're always looking for a strength-based solution, means we shouldn't automatically go that they don't want to come. There might have been a reason why they couldn't come, and that conversation afterwards may well help overcome some of those challenges for engagement, and it might just be as simple as collecting rather than expecting people to turn up. And I got experience of that in the past, where we sort of, it was sort of a mini contract that went there, because the minibus was going to come round and pick you up. You were sometimes less likely to hang out the window and say, I don't want to come tonight, because there was a little bit of an informal contract there. But it is really important to follow up, because there could be a variety of reasons that could have occurred, including escalation of the issue because of involvement in the programme. So need to be aware of the risks, as well as actually overcoming the barriers as well.
Okay. Next question then, how can we support families so that we avoid the intergenerational transmission of negative parental conflict outcomes? Who wants to pick this one up?
Ooh, that's a tricky one. I mean, you know, there is good evidence, isn't it, that the behaviour you see is the behaviour you become. So there's something really about actually, through our programme, beginning to help parents where there is conflict, to overcome that conflict, but also begin to model some of the behaviours that you would expect them to see in their children, or hope to see in their children as they move through. So I think I go back to the point at which we keep making here. It's about relationships. It's about the relationship between the practitioner and the facilitator. It's about the relationship between the parent and the child and the parents. So we could almost turn around and say it's all about relationships. And indeed, in this instance, I think it probably is. And that's where we need to support parents in their endeavour to be the best parents that they can be.
So the practitioner training that I've spoken of for practitioners in local authorities, local authority areas, does endeavour to equip practitioners to start those conversations, and also to expose them, but in a constructive way, to the impact that conflict can have on their children, and to focus it on making a better life for their child, rather than in a sort of judgmental way. But there are various practical tools in there as well. So we hope that will be useful. I mean, in the longer term, I feel I have to slip in a reference to the policies of a different department altogether, which is Department for Education, which of course have and are in the process of making statutory relationships education, both at primary and secondary school level. So in terms of looking much further ahead, there is a real hope that children, young people going through schools will be learning about what constitutes a healthy relationship, even if at primary this is more in terms of friendships than actual partners, but that learn to recognise what a good and healthy relationship looks like, so as to help them make better choices than perhaps their parents have done.
So something really important about messages for all of the participants here about healthy relationships and modelling good relationships all the way through. Okay. Next question then, how can we best reach disadvantaged and vulnerable families through digital means? Jenny, I think this is probably one for you.
Yes, so as I said, we've done a small study, a small bit of qualitative research with some disadvantaged families to try and find out what might work through a digital vehicle. And those findings have really been helpful, and it is a piece of research that we do look to publish fairly soon. The sort of things we found out are that the sort of parents we want to target very often do have a lack of awareness of the impact of conflict on their children's well-being. So that's something we absolutely have to bear in mind. They're not going to go looking for help with their conflict. Really, because and we've never thought that they are that likely to self-identify for face-to-face or digital, but we need to be mindful of that, and so really try and catch them where they go digitally. So if they're likely to be looking on health websites or something about debt, then it sounds from what we've learned as if they're the sorts of places that it would be helpful to put content. The parents interviewed expressed a very clear preferences for using forums to validate their feelings and for peer support, and online videos as a sort of learning tool. So the sort of heavy text, and I think Inês, you referred to that as not being very compelling, the heavy text that we see on some digital support currently for parents is unlikely to engage this particular group. So various other points, I mean, we do have to be mindful of the level of digital skills and reading skills as well in what we design. and make sure that we maximise user engagement with the right sort of search engine optimization strategies. So we've pulled all this together, and the department is running a challenge fund. We've been looking at bids recently on how to take that learning on digital and actually take it to the next step, whereby we test out some actual approaches to engaging parents, and that is something we'll be doing. So it's on a slightly slower track, face-to-face, which we started on first, but we have a very serious wish to find out what might work digitally, because there are those for whom pulling out the smartphone and the group generally use smartphones is a better solution for them, or at least it's a start. So that's something we will share before long.
So a perfect opportunity actually to look at some of the principles from this report and how they apply in the digital space as well.
Yes,
yeah, very interesting.
Yes.
Okay, so now we're going to look at the questions that you have posed. We're just bringing them up. Give us a second. So, first question from Mary Connor. Was there any evidence found about the use of volunteers in the delivery of the programmes to break down barriers? Inês, do you want to comment? So, particularly the use of volunteers.
We didn't come across any evidence on the use of volunteers in the delivery of the programme.
So less about the paid or unpaid nature, more about the community background, perhaps.
I don't think I understand the question.
The fact that they reflected the communities that the intervention was seeking to.
Yeah. In terms of sort of the practitioners coming from similar backgrounds, from the participants, and also, in fact, there's a case study in the report around a program called Empowering Parents, Empowering Communities, which uses parents that have gone through that program and uses them as facilitators in the next round of delivery, so that the people facilitating the intervention really do have a good understanding of not only the problems faced by the participants, but also the actual program.
Yeah. So from this review, Mary, it was more about the characteristics of the individual and their understanding and relationship, rather than whether they were paid or unpaid. I don't know whether we would have a view at this point about whether that was a factor. Patrick?
Well, it's not in the review, but in my experience, graduates from various programs actually delivering the program or co-facilitating them are an incredible, powerful presence in the program, and add a great deal of authenticity to the program that's being delivered. So I reiterate exactly what Inês said, but if you've been through it, you're going to have a very, very good handle on what it's done for you.
Yeah, so there are various parenting programs, aren't there, which are designed to actually be run by, as you say, graduates. But of course, yes, they've got to be deployed to preserve the integrity of the program. But it'll be very interesting to find out as the evidence increases and the market develops, whether there is a place in these programs for volunteers.
So at this point, I think what we are saying is there's something about the word that Patrick used, authenticity, rather than paid or unpaid. Next question then from Lucy Ann Bryant is, as suggested in the review, how do we encourage providers to offer programs at the appropriate time of day to allow for engagement? So encourage providers to offer programs at the appropriate time of day. Who'd like to pick that one up?
Well, that's if not explicit, then implicit in our IT team for the face-to-face services. I think we did cite that as an example of you have to take this into account, parents' availability, because after all, you may not get the parents crossing the door if you don't do that.
Yeah, and equally, you have to remember that 20% of the intended cohort will be could be working families, and that would make it more difficult if it was just purely in the daytime. But equally, thinking about a typical work pattern, some people work night and sleep during the day.
Yes.
So you've got to be thinking a little bit more broadly about whether you're doing something at a weekend or whatever, but bearing in mind that childcare may be an issue at weekends. So it's about actually developing a degree of flexibility around what you're offering, but equally knowing your target audience, or those who are on a particular course or program well, in order that you can adapt to them.
So in principle, I think we certainly all agree that this is a good thing, and it seems very relevant to the literature review. Are there particular levers for this at a local level or a national level to make sure this happens? What would you expect to see at a local level? Because it may be more expensive or more complicated to have that kind of flexible model. In fact, lots of public services offer less flexibility because they can't afford it.
Yeah, I think there is something around the flexibility of the workforce. It's important to recognise that we ask people to work 37 hours, but we could not specify that 37 hours are worked from morning till evening, but actually the flexibility that some job descriptions will have, that there will be a delivery of some of this, not increasing the hours or the hours or the pressure, but actually building into contracts that there are times when these will be delivered. So, you know, you might work 4 days 1 week and then do a fifth morning on a Saturday. Controversial maybe, but we have to, particularly in our funding envelopes and the pressure that we're under, thinking about more innovative ways to engage with families, so we reduce the cost and demand on higher cost services. Because the argument here is that there is a cost avoidance argument, that if we resolve some of the issues in families much earlier on, we will gain some benefits for those families and for those children as they move through their life. So it's important not to lose sight of the cost avoidance argument, although in our present climate, we're more about cost savings than cost avoidance, because that can be a long time coming.
So, Lucian, I'm not sure we've really found a solution to your question. It feels like a really important question. Actually, EIF published a report last year looking at trusted relationships for vulnerable children with adults who can help them at key moments. And one of the issues raised in that review was about the difficulty of fitting vulnerable teenagers who are looking for flexibility in the approach they receive, and organisations that can feel quite restricted in flexibility of opening hours and availability of service. I think the same feels true here. It will be very useful for us to learn as the face-to-face programmes roll out about how people respond to this question which you've identified. Another one from Lucian then. Interesting to say that GPs thought it would increase their workload. This is a case put by many partners. You say it will reduce their workload, which we all know, but how do we get these partners to really understand this, and when time poor to actually engage with the programme? So how do we win people over who are resisting because they can't see the argument about it saving them time?
Use the strategic leadership grant in order that you build some effective relationships with partners, whereby some of these issues I think can be dispelled with a good facilitator. But there's also an argument here about that what's being added into the system is something, an additional resource that will potentially be an issue of concern to some practitioners, whether they're GPs or not. The act of actually filling in the referral questionnaire has been raised a lot to me about it potentially impeding and acting in the same way as the CAF did with certain partners where they had to do that. But we did overcome that by engaging through different channels in order to get different institutions, if you like, or organisations to think this was their business. I go back to what the constant theme here is about relationships, and it is about finding that person within an organisation who could champion this. In the local family offer, we formed a small steering group, but it was a coalition of the willing. Sometimes you actually have to get the coalition of the willing to get going first. And then the ripple effects can actually cascade, ripple out, not cascade, that's a waterfall. But relationships at the heart of this integration agenda, and I'm not diminishing how hard it can be with some parts of the public sector and the voluntary sector, but I think it's worth the effort.
Jenny, any water metaphors from you?
No, I won't go into the metaphors, but just absolutely agree with what Patrick's saying. Yeah.
Okay. I guess one reflection from me would be that there are particular sets of stakeholders who are not hearing their leaders talking about this agenda in the way that local government are now. I think we still have a challenge to get people in schools and GPs talking about this agenda and championing it. I think that's an issue at a national level and a local level. We need to nurture and develop those champions, because just as the messages in the review are about people being more willing to listen to other people who are like them, that applies just as much to the workforce too.
One it's a line factor is I'm really pleased that in the Select Committee's report on the 1001 critical days, they make reference to reducing parental conflict. So there is a movement going on where this term is being used in documents where previously we probably would have heard about domestic abuse, but actually they're separating out domestic abuse from reducing parental conflict. And the more that happens at the national level, and we get into spaces where there is influence, like I've done some work with the BMA, then we might have an opportunity for that cascade to come down from national organisations that actually not just signposting to the programme, but actually making the case for why you would want to be involved in it, and what it can do to alleviate your workload and deal with some of the issues that you face day to day.
Okay, we've got another couple of questions here. First one from Alice Clements-Platt. There are a number of fantastic findings, but some are not in line with the new RPC contract processes. Will DWP be updating the processes to include these findings? That's a good question. I don't know whether you know which ones those specifically are that are not in line.
Well, it would have been helpful to know what they are. I mean, certainly I've been saying, we'll listen and learn. So, I mean, if you have specifics, Alice, then do pass them to DWP, and we will certainly cross-check. I like to think that so far the contracting process has been pretty much in line with these findings about engaging families, but do by all means send in any points you've got. We'll look at them.
Alice, I'm going to move us on to the next question. So it's a perfect opportunity for you to add something more to that question, and we'll come back to it if you do. This question is from Amanda Patterson. Is there any evidence of the impact of using an early help assessment and plan as a multi-agency tool alongside the intervention? To what extent should this be designed into our local pathways for accessing the RPC interventions? So evidence of the impact of using an early help assessment and plan as a multi-agency tool.
I think this is an issue for local pathways, about how the system there reflects the information with regard to parental conflict if it's in evidence. But I do take your point that there needs to be some join up with what we're talking about, the referral gateway questionnaire, and what's recorded locally on any early help assessment or child in need, whatever that might be. I think I would actually have to reflect on it a bit longer than I've got now in order to give you a comprehensive answer. I'd want to consult some of my other local authority colleagues around that, and I can come back to you, Amanda, if that would be useful to see whether we can identify some impact of it occurring.
Any other comments from the panel? Having had a moment to reflect while Patrick was speaking, thank you, Patrick. I think that what we can say from this review is that we think the interface between the wider context of an early intervention system for families is really important. So it's not about seeing the intervention in isolation. What we also know is that multi-agency early help assessments and processes vary widely. So it's very difficult to generate evidence about something which is applied in a very broad and diverse way. So you can't point at a particular set of evidence which tells you that early help assessments or processes work because of that difference in how they're applied. I think the question is whether the local system is coherent and organised and supportive of an individual intervention. That's the critical issue here. Are there any final questions that we haven't come to yet? Okay, in which case it is now 4:01, so I'm going to say thank you very much to the panel, and thank you also to you as the audience for engaging with us. We look forward to continuing the conversation with you. Thank you very much.
Thank you.
Thank you.